Good morning. My name is Ravdeep Deal, and today I will be performing the neurological assessment. I have Kamal Panu here with me. Before I begin this video, I would like to inform her that this video will consist of a neurological assessment that will consist of me touching her throughout various body points. I will also be testing her sensory reflexes, um, her point of perception, and this video will also be viewed by Nightingale evaluators for grading purposes. Do you consent?
Yes.
Okay, so now that she consents, I can begin the procedure. So before I would go into my patient's room, I would knock, I would provide a patient privacy, I would do hand hygiene, and then I would introduce myself to the patient. Um, Good morning, my name is Ravdeep, and today I will be doing a neurological assessment, which was ordered by the doctor. Before we begin, can I please get your first name and last name and date of birth?
Yeah, Kamal Panu, birthday 1/1902.
And then I would also look at the patient's wristband for confirmation. So that way we know that we have the right patient. But when during the initiation of this procedure, the first thing that I will do is ask you if you're comfortable with me going ahead and performing this procedure.
Yes.
Okay, so now what we will do is we will ask the patient to close her eyes, and we will grab an object. So we could use a pen, and we will touch opposite ends of the pen on the patient's body and ask them what part they feel. The pointy part is, of course, the part that has the cap, and then the dull part is the part that is flat. So you can go ahead and close your eyes, and you can bring your arms out like this, just like that. You close your eyes, and then I will ask you what part of the pen you will feel, and you will tell me pointy or flat.
Pointy. Pointy. Flat. Flat. Pointy. Flat.
Okay, so you can go ahead and open your eyes now. So this patient has uh, successfully completed that part of the procedure. Our next part of the procedure is I will be moving your fingers on both sides and your toes on your feet, and you will tell me if I'm pushing them up or if I'm pushing them down. And for this part of the procedure, you will also be required to have your eyes closed. So you can go ahead and bring your arms out like this. And am I pushing up or down?
Down. Up. Down. Up. Down. Up. Up. Down.
Okay, you can go ahead and open your eyes now. Our next part of the assessment is I will be asking the patient to, I will be getting two objects that are the same size and the same texture. So I have two highlighters, and I will be asking the patient how many points they feel. So they will also be required to close their eyes for this step of the procedure. So,
Flat.
no, how many points do you feel?
Oh, two. Two. One. Two. Two. Two.
So now that the patient has completed that part of the procedure, the patient can open their eyes. The next part of the procedure is I will be testing the patient's deep tendon reflexes. So we will begin with the brachial reflex, which is located on the upper forearm. We will be using our reflex hammer. If you do not have one, you can also utilize the bell of a stethoscope. So for this part of the procedure, I will be locating the brachial tendon. And once I locate that, I will be using the pointy part of the hammer to not aggressively hit the patient, but we'll be lightly tapping that tendon, and we will be observing their extremity for any movement. So that was a +2, which is an expected finding. So I will also repeat it on this side. Okay, and then the next reflex that we will be testing is the patellar reflex, which is located in the knee area. So we will locate the kneecap, and right below the kneecap, we will locate the tendon, and we will lightly tap using the flat side of the hammer. And that was a +2. The next part of the assessment is that we will be testing the plantar reflex, which is located at the bottom of the foot. So we will be grabbing the patient's bottom of the foot, and then we can use the pointy end of our hammer. We can kind of make like a circle in the shape of a candy cane, and we're just observing to see if the patient's toes curl towards the hammer or if it stays flat. So in this case, they've stayed flat. And the next part of the assessment is we will be grabbing the patient's foot and testing for the clonix reflex. So we're just observing the foot to see what happens when we let go of it. So you can relax your foot, and I will grab your foot and I will let go of it. And we're just observing to see if there's any dangling, which is expected. There's no extreme movement of the foot. So now that we are done with that part of the assessment, we will be touching the patients on various parts of their body. The patient will be required to have their eyes closed, and the patient will tell us which side of their body we're touching and which part of their body we are touching. So you will be required to have your eyes closed.
Shoulder.
What side?
Right. Hands. My left side. Left shoulder. Right knee. Left knee.
Okay, you can go ahead and open your eyes. So the patient has passed that part of the assessment. The next part of the assessment is we will be grabbing a common object, and we will be asking the patient to identify what the object is. So the patient will also be required to have their eyes closed for this part of the procedure, and we will just place it in the patient's hand, and we can test the patient to see if they are able to identify the object.
Marker.
Okay, the patient has passed this part of the assessment. The patient can open their eyes now. The next part of the assessment is we will be grabbing the palm of the patient's hand, and the patient doesn't have to have their eyes closed for this part because they can't see it. They can stare off at the wall or whatever it is, and we will draw any object. We will draw a letter or a number, and the patient will tell us what number we drew on their palm.
3.
Yes, the patient successfully completed this part of the assessment. So the next part of our assessment is the Romberg test. So for this part, the patient will be required to stand up, and we will be supporting the patient right behind them in case if they have any loss of balance or dizziness. So the patient will now be asked to stand up and right in front, and we will be standing, and the patient can face directly at the wall, and we will just be observing their posture, their balance for a total of 60 seconds. Okay, so that was 60 seconds of the patient standing. The patient did not have any loss of balance. We did not need to support them in standing. The next part of the assessment is a gait assessment, in which the patient will be asked to take a few short steps from one side of the room to the other end of the room, and we are really just assessing their gait, seeing if they need any assistance with walking, seeing if there is any sort of difficulty in coordinating movement. So we will be switching the position of the camera now, and we will be assessing the patient's gait. So the patient will walk from one side of this side of the room to the other, so we can assess them. You can go ahead and just walk normally. And the patient will now walk back. So the patient did not have any hesitancy in their gait. They were able to walk back and forth without any hesitation. One foot successfully passed the other. There was no limping. There was no loss of balance. The patient does not use any assistive devices to help them walk. The patient did not express any pain or any discomfort during this movement. So once we have our findings from this procedure all gathered and the procedure itself is completed, we can go ahead and document this procedure and of course get the patient back into a comfortable position. If they are admitted in the hospital, we want to get them back into bed in the lowest position, make sure call light is within reach, and then we will step outside of the room, perform hand hygiene, and document this procedure. And that concludes the neurological assessment. Thank you for watching.